Cataract surgery is a transformative procedure that restores vision by replacing a cloudy natural lens with a clear artificial one. The process begins with the patient receiving local anesthesia to numb the eye, ensuring comfort throughout the surgery. A tiny incision, often less than 3 millimeters, is carefully made at the edge of the cornea. Through this small opening, the surgeon inserts a specialized instrument to gently break up the cloudy lens using ultrasound waves, a technique known as phacoemulsification. The fragmented pieces of the lens are then meticulously suctioned out of the eye. After removing the natural lens, a folded intraocular lens, IOL, is inserted through the same incision. Once inside, the artificial lens unfolds and is precisely positioned in the same location as the original lens, behind the iris and pupil. The incision is so small that it typically does not require stitches and heals naturally over time. Most patients notice improved vision within a few days following the procedure. Modern cataract surgery is quick, usually taking less than 30 minutes, and is considered one of the safest and most effective procedures in medicine, offering a significant improvement in quality of life.